What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we'll cover the first day of clinicals as a student. To give you some context, I am a fellow Xray tech, do graveyard. Been doing it for 2 years. Trauma 3 ER, where you kind of do the whole hospital. But anyways, you'll never forget it. Once you're in my position, you'll never forget your first day. It is both magical, you might quit, you might be filled with hopes and dreams by the end, you might, all kinds of different reactions, because like you'll go on your first day and you know the next day when you go back to regular class, the teacher gonna be in there, like, you know, SpongeBob, and he'd be like, mad grinning, he's like, I like mad grinning, be like, so, tell me what happened. type, a look of just everything. You know, because she already know. Like she wants to hear the, you know, the good spice or the good, you know. But anyways, like the first day you'll get there, you're probably probably didn't sleep. You're nervous. You're like going through your little positioning book, like shit. Like I gotta know all this type of deal. You probably Googled your place, kind of get a better insight. Like you'll die. It's a lot. It's a lot, boys. Nervous, you're in there, you little scrubs. Get in there, and then your day kind of goes depending on the techs who are there. Because if you get some of the like people who've been in the game for so long that they forgot what it's like being a student, you're kind of like a burden to them. And then you have the people like me who are kind of fresh out the game, so they understand you and they're willing to help you. So it all kind of depends. And then there's some who just hate students, even though everyone at one point was a student. So you have that type of stuff going on. So, kind of whatever floats your boat. That kind of will determine how your day goes, I would say, for sure. So, I would for sure get there early, especially if you're in a big hospital. You'll probably get lost. You may not have access to the department. You might have to go through some loops to get back there. Make sure you get there early. Kind of get a little general rundown of the joint by the tech. Usually the supervisor or whoever's in the department will like, hey, this is where we do x-rays. This is the main department. These are the other departments of the radiology. Cafeteria, bathroom, a whole shebang. Almost like you're starting a brand new job. Kind of think about it like that. And they'll give you basic, this is what we do for certain views. Because every department, every place, every doctor likes different views. And they'll show you their equipment. How this one's a little fucked up. You gotta do this and that. And every little quirk type, there's always something. You'll have that to deal with. And then you'll get in there, and of course you'll be nervous. They'll be like, all right, here's a chest x-ray, go do it. You're like, I need to see one. They're like, all right. And they shoot one, you saw it, and then you'll throw you in again, and you'll be like, I still don't feel comfortable. Or like you'll like move anything, you're like, is it okay? Is it okay? Can I push it? And like type deal. Or you'll get the text and be like, all right, push it, and you'll be like, boop. And you look at the picture and you're like, they don't look right. And they're like, nope, sure don't. You clipped it. And you're like, okay, you moved again. Okay, beep. Clipped it again. And then at that point, you either hope that the tech steps in and be like, yo, this is how you do it. Or they're the committed, you're gonna learn this by yourself type. You're gonna do it and you keep on type deal. I've seen techs let it go through like 4 or 5, and then like by the 5th one be like, you making the patient nervous type deal. So you'll have that going on. Then on your little lunch break, You'll be on your phone because you're not supposed to use your phones during clinicals, HIPAA and all that stuff. During your little lunch break, you'll be in there in your little breaks. Oh, how are you guys doing? Or your family, oh, how are you doing? Like type deal, and you're just like. My experience was amazing. I got there first day. That's where I work at currently. First day, got in there, and I got put into the hands of one of the veteran techs who've been pushing the button 20 years. Took me under his wings. Respect to that man. Taught me everything I know. And I went to do my first chest x-ray. Shot it. Perfect. Lateral. Shot it. Perfect. And like a part of me got a feeling that this is what I want to do for the rest of your life. I just got a feeling of like, yeah, I like this. Like, this is amazing. And then especially when the tech was like, okay, this is the online portion. This is like where you begin the exam, the name of the patient. This is all we do. And I was like, this isn't that hard. And then he's like, okay, go shoot it. And then we shot it and say, okay, now what do we do? He said, okay, now we dictate it or whatever. We put it online. And then the rad reads. And that's it. And then we chill. And then we're like, oh. And I'm like, you get paid money for this? He's like, yes. And I was like, oh. It was like that first, it only took like maybe 5 minutes of doing x-rays where I was like, yeah, I'm gonna do this type deal. And then other people, they've dropped out. Other people, they got sick, had someone pass out because they saw blood, trauma, especially your first trauma. You if you had one on that first day, best believe you'll never forget it. That's another big one too. Or if you mess up really bad, you'll never forget it. And then kind of you're there. In general, you can get there between, I think it's like 7:30 or 8, or depending whatever your clinic does. And then you kind of end up like, I think it's like 3:30, 4:30, whatever type deal. By then, you're probably like pooped out, tired, because like majority of the times, as techs, we're always told, yo, let the student do the work so they can learn. That's why they're here. So you might carry a little bit of the load. You'll be a little bit more tired than normal. So that is kind of the little spiel of what happens. And then all depending on the protocols and all the other different things that's going on, they'll teach you all that so you don't get in trouble, because at the end of the day, when you put something online and it's your little marker, you're still running it under homeboy's credentials. So they got to make sure that it's good. That's why they always tell you, let the tech who's with you look at it and be like, yay or nay type deal. And as far as like your clinicals and stuff, directors and stuff like that, some of them will show up there, greet you. Other ones will go randomly and they won't tell you, and you have to be in your little uniform type deal. They'll explain to you all that. Closed-toed shoes and all the other little things that go along with it. But yeah, it's been your boy Miguel. Hope you enjoyed these videos, and see you on the next one.